My name is Lily and I'm performing a newborn assessment on this baby. So to start my assessment, I'm going to make sure that I have my supplies, which for this assessment will be gloves and a stethoscope with a pediatric bell and diaphragm. I'm going to make sure that the vital signs have been taken on this baby and that they are within normal limits. I'm going to assume that that is true. I'm also going to identify this baby through its parents, just so that I don't have to disturb it if it is asleep. I'll be performing this assessment on a warmer because we don't want baby to lose too much heat through its skin, and we want to keep baby warm. So I'm just going to start by assessing the level of alertness. A baby could be crying or could be in a deep sleep or a light sleep. This baby is alert and its eyes are about halfway open, so he's looking good. Okay, so first I'm going to note muscle tone. It's moderately flexed and not flaccid or rigid or anything like that, so that looks good. Starting up at the head, I'm going to look at the skin, make sure it's pink, there's no breakdown or anything like that. There's no skin discolorations or hemorrhagic spots or anything. At this time, I could maybe note if there were any stork bites, which are discolorations that blanch when you touch them, or possibly port wine stains, which are also red discolorations that do not blanch when you touch them. Those usually do not go away. They're usually permanent. At this time, I will look at the sutures. You look at the frontal suture in between the frontal bones and the coronal by the parietal bones. Then look at the sagittal, and in the back, the occipital bones are separated by the lambdoid suture. So, if you can see the lambdoid. These sutures can either be well approximated or they can be overlapping or split. So those are the three options for the sutures. I'm also looking at the fontanelles. They should be soft and flat. If they're bulging, it could indicate infection or edema or something like that. If they are sunken or depressed, it could indicate dehydration. So you want the firm or the flat, soft fontanelles. That's ideal. I'll also notice any swelling at this point. There's something called succedaneum, and that is edema between the scalp and the periosteum that crosses suture lines. So it's a softer swelling. Then the other type is cephalohematoma, which is blood built up between the skull and the periosteum, and this doesn't cross the suture lines. So you'll be looking for those in your head assessment. Moving on down to the eyes, they should be symmetrical with no discharge or anything. Sometimes you'll note redness in the sclera. This is called subjunctival hemorrhage, and you sometimes see that after the birth process. Eyes can sometimes be swollen also after the birth process. It's a pretty traumatic event. And the crying at this point should be tearless. So note that as well. You're also going to look for nystagmus, which is involuntary movement of the eyes, and you'll note that, and also the reflex response to light. On the nose, you're going to check to make sure it's midline. You're also going to check for nasal patency. So what you want to do for that is tip the chin up, and you close the mouth, and you cover one nostril, and check to see if there's any difficulty breathing. And you want to do that bilaterally. So that's just to make sure there's no occlusion in the nose. You're also going to notice any nasal flaring, which would indicate respiratory distress, and you're also going to make sure there's no cleft lip. That would be an abnormal finding. Now, on the ears, the outer canthus of the eye should line up with the top of the pinna. If not, it could be some sort of a genetic thing. The cartilage should be firm, and when you press it down, it should recoil. If not, that could be something found on preemies, extra soft cartilage. Also, I will just be noting throughout the assessment that baby responds to my voice and to noises around it. So now at this point I would put on my gloves to assess the baby's mouth. So you're going to look first at the tongue to make sure it's symmetrical, it moves freely, and it's not protruding or anything like that. You're also going to look at the gums to make sure that they're pink and free of teeth, so I can palpate in there for that. I also feel the palate and make sure that's intact. I'm also going to check right now the suck reflex, so that's just when I stick my finger in baby's mouth, baby will suck on it. And I'll also check the gag reflex. I'll actually touch the back of the throat to elicit that gag reflex. I will also check for circumoral cyanosis, which is blueness around the mouth. And I'll also check the rooting reflex, which is if I go like that on baby's face, they should actually turn towards my hand. They were the source of food, they think. So I'm going to take off my gloves right now. Now I'm going to move down to the chest. It should be barrel shaped. I can inspect the skin and make sure there's no problems with any of the skin. I also note diaphragmatic excursions and also make sure that there's no retractions, which again indicates respiratory distress. I'll check the clavicles. The way to do this is by lifting and rotating baby's arm. If the clavicles are broken, baby will be screaming in pain. So that's the way to do that. You'll check this bilaterally. You'll also note any crepitus in the joints when you're moving them, and note that. The nipples are both symmetrical, the breast buds are well formed and prominent. The heart. We're going to move on to the heart. For heart sounds, you want to check the apical, the fourth or fifth intercostal space on the left. A normal heart rate is within 100 and 160 beats per minute for a baby, for a newborn. So you'll check that. There you also note any heart murmurs, which is an abnormal finding. So apical, fourth or fifth, mid-clavicular on the left side. You're also going to auscultate on the for 5 heart sounds. So you'll start on the right second intercostal space, which is the aortic valve. Then you're going to move to the left second intercostal space, which is the pulmonic valve, down to Erb's point in the left third intercostal space, over to the left fourth intercostal space for the tricuspid valve, and the fifth intercostal space for the mitral valve. So you listen to those heart sounds, make sure they sound good. If you note any abnormal heart sounds, you should note that, and any heart murmurs or anything like that. You're also going to listen to respiratory sounds. So you'll do right, top, left, left, mid, and right. And so for that, you'll want to note that they are equal bilaterally, and you will note any crackles or wheezes. Wheezes will actually indicate that there is fluid in the lungs, or the crackles will indicate fluid in the lungs. If there are actually no breath sounds heard, that could indicate atelectasis, which is a serious finding. You're also going to notice any retractions or nasal grunting or flaring, which could all indicate respiratory distress. Okay, so now I'm going to move down to the brachial pulses, which I'll take right now. You take them bilaterally and make sure that they're present. You're also going to check the grip reflex. So what you want to do is put your finger in baby's hands, and baby's fingers should curl around yours. This is also a good time to check the ID if you haven't done that, and make sure that's the right baby. You're also going to look for acrocyanosis. With acrocyanosis, you will see that baby's head and trunk are pink, but her hands, his or her hands, and legs are actually blue. So this is an abnormal finding. You're also at this time going to check the Moro reflexes. So what this is you do make a loud sound, you hit the table, baby's arms and legs should extend, and their fingers should curl up as they are startled by that sound. You could also, yeah, so we're also looking at the abdomen now. We're going to make sure that the abdomen is round and not distended. You shouldn't be able to see any like intestines through the skin or anything like that. You're also going to check the umbilical cord. There should be no odor or signs of intestines like coming out from there or anything. You can actually use the cord for a pulse site. It's 2 arteries and a vein in the umbilical cord, so you can use that as a pulse site. Okay, you can also check the liver and palpate that, and yeah, so that's the abdomen. Now we're going to move on down to the genitourinary. Okay, so in a male, you want to check to make sure that the testes have descended into the scrotum. I want to put gloves on for this and just palpate the testes. They should feel like a P, so you want to feel for that. And then also you will notice any discharge or inflammation here. There should be rugae on the scrotum. And also you should note the passage of the meconium, which should pass within the first 24 hours. You'll also note that the urinary meatus is on the tip of the penis, not on the top or on the bottom. It should be right at the tip. Yeah, so that's for a male. I also have here a female. So we'll look at that too, because it's a little bit different. So for a female, you're going to make sure that there's no edema or anything like that. There's no bloody vaginal discharge. There may be that. It could be normal from the mother. The labia majora should be larger than the labia minora. It should be actually covering it and also covering the clitoris. In preemies, the labia minora is usually bigger than the labia majora. So in this full-term baby, the labia majora should be bigger. You're also going to note that the meconium has passed in the first 24 hours. And that's the female ureter. Okay. Now, moving on down, you can take your gloves off at this point. Moving on down to the legs, you want to make sure that the thigh folds are symmetrical. You're also going to check the femoral pulses bilaterally, but you're going to want to do these not at the same time because this could elicit a response from baby. You're also going to move down to the feet and check the Babinski reflex. This is when you start at the heel, move up in a C shape. Baby's toes should fan out with the Babinski reflex. You're also going to check the plantar reflex. You put your finger under baby's toes, and baby's toes should curl around your finger. That's a positive plantar reflex. You're also going to note that baby's soles, newborn soles are usually well lined, so you should note that. And then lastly, we're just going to move to the back to baby's spine, which looks a little different in my baby here. But you're going to make sure that the spine is vertical and midline on baby's back. You're also going to note any sacral dimples or tufts of hair. This is a sign of spina bifida, which is not a normal finding. And also, we're going to look for Mongolian spots. This is more common in dark-skinned children, but they're just spots in the sacral area, and they're nothing to be concerned about. And that is all. You just swaddle baby back up and call it a day.